We all know that in this province we have access problems that are well known across the province, and in many ways we know what were the solutions, and we've known that for a long time now. What we have today on our table is an agreement by which we will help each other basically, and make so that between now and December 31st, 2017, 85% of Quebecers, which to us is everybody who wants to have access to a family physician, will be registered to a family physician. And we will also have a change of practice of family physicians put forward by Dr. Gaétan himself and his own organization in such a way that access will be guaranteed in any situation in a short time period. And by doing that, it will be quite possible that Bill 20, if adopted, will never be implemented regarding to family physicians. This deal that we have together is about family medicine, period. It's not about the specialists. They have to keep reflecting on their positions on this. But today, what we're announcing is a strong commitment, a strong engagement towards results. There are numbers on the table within the agreement that will make so that in the next 2 years, everybody in this province will have access in a short time period, like in a matter of days, to their family physicians in any situation and anywhere in Quebec.
You know, I will not repeat what Dr. Barrette said, but you have the commitment of the GP to improve the situation about the access. On the other hand, we have the commitment of the government to improve the environment practice of family physician and to change the focus from the hospital to the primary care and the private clinic. So for us, we have the condition to be able to reach the goal that we have at the end of 2017, and for us, the important goal that the PLP will be over at this moment.
Can you kind of practically how this would work for somebody who's without a family doctor right now? How would this system work? Would there be like a centralized call system that they would call to be able to get an appointment with the doctor and then maybe continue to be followed by them?
By both ways, directly by the guichet d'accès, or you know probably that many family physicians will accept to take new patients directly if you come to their private office and to have an appointment and let the family physician decide to take him in charge, probably the both way.
So this basically abolishes the quota system that had initially been set up under Bill 20's proposals.
Yeah.
Bill 20 will be studied, maybe will be passed, but between now and December 31st, 2017, it will not be implemented regarding family physicians.
And for you, Dr. Gaétan, how will this change things for doctors in terms of how they will work?
You know, many ways probably to manage different with their appointment, to be able to see their patient faster than before, and probably some change in our general agreement to make the fact that the family physician will take more patients. But you know, it's a way that the GPs agree. It's a commitment of the GP, and it's on the way of the solution that we put on the table in March, solution that we present, and we have the agreement of our GP. So it's clear for us, it's the best way than PLP. It's what we want, and we think it's the best way to improve the access to a family physician in Quebec.
If I can give you an example, to be more blunt, you've probably heard about advanced access elsewhere in North America. There's a strong engagement from Dr. Gaétan and his organization to move massively doctors from their actual type of practices towards advanced access. And you know that in advanced access, you have your appointments within 3 days. I'm not saying that we will have that specifically, but we're going to go close to that by December 31st, 2017, for example, right? And we've also agreed to monitor the evolution of the actual situation towards that goal. In the meantime, and Dr. Gaétan has agreed to intervene when necessary if the progress is not seen correctly. If nothing is moving, as proposed, well, he will have the power to intervene within his own members. So it's a game changer that we are signing today, that we are agreeing upon today. It's a huge game changer. And again, I need to say that again, it's an extremely significant effort and commitment proposed by all family physicians.